We want to reiterate at this time that we are not only looking after the financial health of all our members, but also we are looking after or trying to look after their physical health as well. And I don't want the male population of the hall at the moment to feel out of place, because breast cancer is something that can happen in males as well as females, although the number in males is a little less than the females. Therefore, males need to be aware of this cancer as well, and they need to also screen themselves periodically, because cancers, generally speaking, are on the rise. And as Dr. Madiha just mentioned, that October is the month of breast cancer awareness. It's called as the Pinktober, and although we are not wearing our pink ribbons today, yet by this presentation we would still like to participate in this campaign for the welfare of all the members. So I would now like to begin with, I would like to emphasize on the importance of this cancer. I mean, we keep on hearing the word cancer, but let's have a look at some stats, because stats have been known to make a lot of difference in turning the psyche of the people towards the awareness against prevention and treatment of these cancers. So who is affected? It is, according to a rough estimate, they say that about 1 in 10 women, or according to some latest guidelines, 1 in 8 women would suffer from breast cancer in their lifetime. This cancer is on the rise. Now, what is cancer actually? Just a small layman explanation of what cancer is. Cancer is just unlimited proliferation of some cancerous abnormal cells in the body. So this can happen anywhere in the oral cavity, in the lungs, or in the GIT digestive tracts. But in Pakistan as well as in rest of the world, breast cancer is now considered to be the number 1 cancer type in females. And it's probably at number 6th or number 7th type of cancer in males. So males need to be aware of it as well. These stats are basically from USA. In USA, as you can see, even over there, 30.8% of the cancers, they are breast cancers in females. The second common cancer is then colorectal cancer and uterus cancer, and then of course in males it's the prostate cancer. Now, coming on to Pakistan, these are the stats that I could take out, although we do not have a registry in Pakistan which would tell us an exact number. But still, according to rough estimates, and these are the studies that have been published in Karachi, Islamabad and Lahore separately, they say that breast cancer is the number 1 most common cancer in Pakistan at the moment, and as such is the leading cause of cancer-related deaths in females in Pakistan. It's most common cancer in Pakistan, and then it is the second most leading cause of death. What is the first most leading cause of death in Pakistan? This would be interesting to know, but interestingly, it's a part of femicide, I mean the murder or accidental deaths. And all women are at risks, all of us. Again, some stats that I took from WHO website, that 109 women die every 24 hours due to breast cancer in Pakistan. This is a huge number, and let me also reiterate this important fact here, that these are not an exact statistical analysis. I mean, there are many that pass on in villages which do not become a part of the stats which are shown here. So this is understated. Over 40,000 deaths a year in Pakistan because of this, and 90,000 new breast cancer cases are emerging in Pakistan annually. Now, these are only our statistics, and you can see how much is the burden of breast cancer even on the economy, what to talk about the healthcare sector. Now, let's have a look at the risk factors. What are the risk factors and why is it on the rise? You could have a family history. If having a family member in the family suffering from breast cancer would make you more susceptible or would increase your chances of developing cancer. Therefore, if anyone has a family member with breast cancer, male or female, they need to screen themselves for breast cancer and its signs. Then we have these 2 genes, BRCA1 and 2. BRCA1 and 2 are important. What they are doing in Europe is that if in a family somebody is diagnosed with cancer, with breast cancer, the rest of the family then undergoes genetic analysis and they try to see whether they have got BRCA1 and BRCA2 gene mutation in them or not. We all know that Angelina Jolie had undergone an elective procedure because her mother and her aunt both had breast cancers and she had BRCA1 positivity. Therefore, she prophylactically underwent the surgical treatment, that is mastectomy, to prevent her breast cancer. Anyway, I would still say it's a little extreme step, but we need to keep ourselves under screening. We have to keep on screening ourselves every year. Then, what are the things that make us more susceptible? In any girl, early periods, if the girl was less than 12 years of age and the cycle started, this would increase the chances of developing breast cancer. Late menopausal changes in women, they are also more prone to developing it. Having children after 30 years of age. Then overweight, therefore we need to keep a healthy weight. Not exercising. Exercising is very important for males and females alike, so exercise. And higher socioeconomic status is a very interesting risk factor. Probably it is associated to a number of things like usage of bottled water that we all are drinking from. And almost everyone has got, I think, a water dispenser at home, and we are even at home drinking water from plastic bottles. That has been associated with breast cancer. And that's what the higher socioeconomic group does. I mean, the lower socioeconomic group usually are getting their water from the wells. And then, of course, the use of microwave oven. So there are certain things that have been implicated in the etiology. Alcohol consumption, not that much in our country, or maybe, I don't know. Birth control pills, especially if your use of birth control pills is during the last 3 to 5 years of your time, then you are at high susceptibility level and you need yearly screening for breast cancer, right? And then no breastfeeding. If a woman has not done breastfeeding, then this increases her chances of developing breast cancer. These are the risk factors. They are not that many and can be easily, kept in your mind so that screening can be carried out. So here I'm just posting Angelina Jolie and how aware, or you can say worried some people can be because of breast cancer, because once it develops, then you have to then go through a whole long procedure. So prevention is always better than cure. Some frequently asked questions and some myths about it, that yes, healthy diet and exercise, they can reduce the risk of developing breast cancer. Therefore, you need to have really healthy habits. And yes, drinking alcohol does increase the risk of developing breast cancer. And no, the size of the breasts has got nothing to do with the risk factor. That is why we say that males are equally susceptible to developing breast cancer as females are. Using birth control pills certainly increases your risk of developing breast cancer, so be very careful. Being overweight, and especially during your postmenopausal time, is also one of the major factors that makes you susceptible to developing it. Therefore, please keep your weight under control, and being slightly overweight definitely decreases your chances of having breast cancer. It reduces the chances. So let's start reducing our weights. So what should be done after all these details? These stats were not given to you to make you worried. The risk factors are only discussed, that these are the common things that are available everywhere, and we are exposing ourselves to them on daily basis. Just be careful, and what to do when we are so much exposed to all these risk factors. We should do tests and early screening. This is the only way to move forward. In Pakistan, most of the breast cancer cases get diagnosed when the patient is at a stage 3. Now, this is a time when radical surgery and chemotherapy and radiation therapy has to be employed. So let's not move to that area, to that stage. Continuous screening of every year, yearly screening would actually make us, make not us, but the people who are developing it get diagnosed in earlier stages, stage 1 and stage 2, and the early you diagnose it, the early we'd be able to treat it. How do we do the tests and early screening? Usually mammography is done. Mammography is now recommended for all women who are above the age of 40 years to have a mammographic examination every year, which we are not doing in Pakistan that much. Then clinical breast exam. Now what do we mean by clinical breast exam? Clinical breast exam is when you go actually to a gynecologist or to a female surgeon and get your breasts examined by that surgeon, not by yourself. That has to be done after every 3 years in all women. And breast self-exam every month beginning at 20 years of age. So tell your daughters and yourself as well and start self-exam every month. A few points to note here are that perform that exam at the same time every month. Usually it is recommended that it should be done on the 5th or to the 7th day of the monthly period cycle, right? And in postmenopausal women, they can just carry out the exam on the same date every month. There are a few symptoms of breast cancer because usually we keep on reading these terms, we don't really understand them. So I thought this photograph would help it, that if anyone feels, male or female, there's no distinction here. If you feel a thick area on the breast, around the nipple, if there is a dimple in the area, if there is a nipple crust, if there is red or area whose temperature is a bit more than the rest of the body, if there's some new fluid that is being produced, if you see a skin sore, if you see a bump anywhere near that area, if you see a growing vein which becomes very prominent and which was not present over there previously, then a sunken nipple, also called as an introverted nipple, new shape or a change in the size or a change in the shape or a hard lump, and an orange peel appearance. Orange peel appearance is the appearance of how the orange skin looks from the top. If that appearance appears, this means that this is the time to immediately proceed to your doctor and have a clinical breast exam. And when to begin screening? For the women, the young ladkiyan who sit right in front during our photograph sessions, they should do it. 3 yearly clinical breast exams they should go for, 20 to 40 years, but after 40, annual clinical breast exam is necessary and annual mammographic exam is also necessary. Some say after 35 years, some say after 40 years, but in Pakistan we are usually not following these recommendations. So in the end, I would just like to say that breast cancer can be cured if it is diagnosed early. It would be very, very simple to cure it in stage 1 and stage 2. So let's spread this awareness, not to take it to stage 3 and 4 before we go to the doctor. Examine yourselves yearly, examine your daughters, ask your daughters to examine themselves monthly, and just keep everything, under observation. Thank you so much.